Hey guys, so this is the urinary system. So let's get started. Okay, the urinary system. So all your blood from your body that's circulating carries waste from your cells to your kidneys, and your kidneys filter that blood to get rid of or eliminate the toxins. So turns it into urine, which is mainly water with dissolved or suspended wastes. Make sure you know that urology is the science related to the urinary system, and a urologist is a specialist who deals with the urinary system. So, what is the urinary system? There are two kidneys, two ureters, the urinary bladder, and the urethra. Let's take a look. So, there is kind of an overview of it. Your kidneys are in the flank area, kind of posterior. You have two of them. The ureter is the skinny tube that goes from each kidney down to the urinary bladder. And then the urethra is where the urine comes out of your body through. Okay. All right. So another more detailed look. Now here you can see your adrenal glands, one on top of each kidney. You can see your veins, arteries, right? The aorta, the hepatic veins and hepatic arteries. So basically, all the blood in your body is going through the kidneys and the liver, okay, and getting filtered for toxins. And the kidneys take that waste and basically form urine, and you excrete it to get rid of the waste. So they lie right underneath the posterior abdominal wall. They're underneath your 12th rib, and they are considered retroperitoneal. In other words, they are posterior or kind of behind the parietal peritoneum, which is a lining of this cavity. The ribs help to protect your kidneys. And also, there's a big, heavy cushion of fat that's around each of them that protects them and acts like a shock absorber. Kidneys are about 4 inches long, about 2 inches wide, 1 inch thick. They go from about T12 to about L3. The right kidney is a little bit lower than the left because the liver takes up some space on the right. And all the structures, blood vessels, the ureters, nerves, enter and leave the kidney through a slit called the hilum, which is located on the medial side. Right here, you can see it. And it's like a little concave notch with a slit that everything kind of comes in and out of. So inside the kidney, what is inside? A tough fibrous capsule surrounds each kidney and pads of adipose tissue, fat, cushion and protect it. The interior consists of the renal cortex and the renal medulla. The renal cortex is the outer region of the kidney, and the renal medulla is the inner region. Then inside the renal cortex, there are renal columns that divide into renal pyramids. Sounds interesting, right? Don't worry about knowing all of this. Just understand that inside is a very complex system that goes on, and that all kind of works together to make urine and to excrete urine. So the base of these renal pyramids faces towards the cortex, and the point faces the hilum of the kidney. The papilla extends into a little cup kind of thing called the minor calyx. And that's where the calyx collects urine that leaves the inner part of the kidney. The major calyces converge together, which is kind of right here, to form the renal pelvis, okay, which is right here. And you see, this is where the urine's made, and then the urine is excreted through the renal pelvis and then down into the ureter, down to the urinary bladder. Okay, makes sense. And they do kind of look like pyramids, right? Okay, so filtration. There's structures inside called renal tubules, and they're divided into four regions. Don't worry so much about understanding the regions, but you do need to know a couple things. Um, the loop of Henle is an important part of this, and the nephrons. They're two things that I do want you to know. So the renal tubule straightens out and dips into the medulla and then returns to the cortex, and this is called the loop of Henle. Later on in med surg, when we start talking about diuretics, loop diuretics, they work on the loop of Henle. That's why they're called loop diuretics. So it's going to make sense, I promise. And then remember, the urine passes through the renal pelvis and then goes into the ureter and down to the kid or down to the bladder. This is a section of the tubule, the renal tubule. And you can see that there's blood flow that goes in and out, right? Arteries come in and out, blood flow, blood gets filtered. The tubules, here's the loop of Henle, this part right here. And then this is the ascending limb of it that goes to the distal tubules, and then the urine goes out. Okay. So from the ureter, from the kidney to the ureters, from the ureters to the bladder. So the wall of the bladder is called the detrusor muscle, and it's got three layers of muscle. Okay. Um, there's rugae, just like in the stomach. There are kind of folds in there called rugae, which allows the bladder to expand and contract. Okay. So when it fills up with urine, the rugae or the folds kind of flatten out, and then that allows the bladder to expand and hold urine. The floor of the bladder has three openings. Okay. Two come from the ureters, one from each kidney, and then one, the urethra. And they form a little triangular shaped area on the floor of the bladder that's called the trigone. This is where, if you get a bladder infection, this is where it attacks. Okay. Um, the urethra leaves the bladder, and there are two sphincters there. Let's take a look. Okay. So here's your bladder. Okay. Ureter, right? Goes into the bladder. This is the trigone here. This is the internal urethral sphincter, and this is the external urethral sphincter and the external urinary meatus. What does all this mean? So you drink, you walk around, you do things all day, and your kidneys 24/7 are filtering your blood. And then they're making urine and they're sending that urine into the bladder. And as time passes, the bladder will become more and more full. Okay. The internal urethral sphincter kind of keeps the door shut so that you don't pee your pants. Okay. The external urinary sphincter is the one where when you say, wow, ugh, I have to pee, and you go to the bathroom, that's the one that you consciously can relax and allow the urine to flow out of. Okay. We'll talk about the urethra, which is that tube that goes from the bladder to the outside world. Okay. In women and females, the urethra is about 3 centimeters long, about 1.2 inches, and it's right in front of the vagina. Okay. In males, the urethra is about 7.9 inches long. You see the difference here. The urethra in the male passes from the bladder through the center of the prostate gland. And this is important. Make sure you remember this. And then it curves around, enters the penis, and then exits the body at the tip of the penis. With men, the urethra passes through urine and semen. Females, we only have urine that passes through our urethra. Okay. So let's break it down. Major structures. You got your kidneys. They do a whole lot. They extract waste from your blood. They manage your body's fluid balance. They regulate your blood pressure. They make urine. And even more than that, you'll see. The ureters are the ones that conduct urine from the kidneys to the bladder. The urinary bladder is basically just a holding tank. It's a reservoir for the urine. And then the urethra is the tube that conducts the urine from the bladder to outside of the body for elimination, voiding, micturition. All of that means peeing. All means peeing, okay, urinating. Now, let's talk about what the kidneys do. They do a lot. They control your fluid and blood volume. That's important because by doing that, they maintain your blood pressure. They regulate all your electrolytes, potassium, sodium, calcium, magnesium, phosphorus. They maintain or they help to maintain the acid-base balance of your blood through something called the bicarbonate, which is the HCO3 negative. That is the buffer of the pH system of the body. That's like the neutral. Think of it as the Tums, right, of the body. The kidneys also activate vitamin D for, making your bones strong, bone calcification. And as we already learned when we did hematology, they make erythropoietin for the production of red blood cells, right? So if your kidneys aren't working, you're going to be anemic. Okay. So they filter blood and they form, store, and get rid of excrete urine. Okay. So what is the waste? Let's talk about that. Proteins, salts, anything toxic, lots of medications and different drugs all get excreted through the kidneys. When we're checking kidney function, there are three labs particularly that are very important. The first one is called BUN, which is blood urea nitrogen. It's nitrogenous waste. And a normal value is about 10 to 20. The other one is another waste product called creatinine, and that level should be about zero point 0.4 to 1.2. And then we have something called the GFR, the glomerular filtration rate. Say that 3 times fast. In a normal average adult, it's about 125 milliliters per minute, which is pretty fast, right? That means how much of the blood can the kidneys filter at any given time? 125 milliliters every minute. That's pretty fast. Okay. So make sure that you know these labs. Don't worry about the GFR, but please know BUN, please know creatinine. Okay. And I will tell you a fun fact. If you're dehydrated, your BUN may be a little elevated, but your creatinine, usually normal. If the BUN and creatinine are elevated, that's more of a significant sign that there may be something wrong with the kidney. Okay. Okay. There's another shot of the kidneys. So this again just reiterates what I already told you. Where are the kidneys? Right. Now let's talk about the parts of the kidneys inside, right? We already talked about it. There's the cortex and the medulla. Okay. The cortex is where you have the biggest parts of the nephrons. And the nephrons are important because they're the smallest functioning unit of the kidneys. And then the loop of Henle we talked about already, right? Part of that filtration system. Okay. Your nephrons are the actual functional units. They're the ones that make the urine. The rest of the system is just kind of pushing the urine through. You have more than 1 million nephrons in each kidney, right? 1 million. Very, very important. And if you look at the picture, it's kind of a good breakdown so you can see. So this is a nephron. And remember, about 1 million. You have juxtamedullary nephrons and cortical nephrons. Say that 3 times fast. Okay. So they're the ones that are actually doing the heavy lifting. They're the ones that are doing the filtration, right? Taking out the toxins, making the urine. Okay. There you go. That's kind of an even more magnified look at the inside of a nephron. Okay. So you've got blood flow in and blood flow out. Okay. Space for the urine, and then the urine goes out. And there's another even more magnified view of the nephrons. Okay. The nephrons have cells in them that make ATP in the mitochondria, just like all cells do. There's antidiuretic hormone that lets the tubules become permeable to water. In other words, makes you reabsorb water. We're going to talk more about that. Let's go to this chart, which I think makes it a little easier to understand. Okay. So let's just talk about 4 hormones right now. Aldosterone. Aldosterone comes from the adrenal cortex, and it tells the kidneys reabsorb sodium, reabsorb water, get rid of potassium. ANP, which is atrial natriuretic peptide, tells the kidneys get rid of sodium, get rid of water. Okay. So, and there's this whole system. So when the heart's atria start to secrete ANP, blood pressure goes up, and then this inhibits the secretion of aldosterone and ADH. So in other words, it makes you pee, right? Gets rid of sodium, gets rid of water. Aldosterone makes you not pee, just like ADH reabsorbs the water. And then your parathyroid hormone tells your kidneys to reabsorb calcium, but to get rid of phosphate or phosphorus. Okay. Getting all this? And then there's this very special system, my favorite, that goes on in the kidneys that is called the renin, angiotensin 1, angiotensin 2, aldosterone, and ADH system. Okay. This is the system that really maintains your blood pressure regulation. Okay. So if your blood pressure drops, then there's decreased blood flow to your kidneys. So the juxtaglomerular cells in the arterioles respond by releasing something called renin. Renin converts a protein called angiotensinogen that's made in your liver, converts it into angiotensin 1. Angiotensin 1 takes a little trip up to the lungs, and the lungs make angiotensin converting enzyme, which converts angiotensin 1 to angiotensin 2. Angiotensin 2 then goes down and says to the adrenal glands, hey, make some aldosterone. And then the aldosterone causes the kidneys to retain fluid, which brings your blood voluming up and your blood pressure up. Okay. This is important. Why? Because when we start talking about antihypertensive medications like ACE inhibitors or angiotensin 2 receptor blockers or aldosterone antagonists, which are three of the big antihypertensive classifications of meds, you need to understand this to understand how they work. And all three of those classes of meds work somewhere in this system to stop it from happening, to bring blood pressure down. Okay. And I know that sounds like a lot, but you're going to get it. I promise. Okay. Here's kind of like a flow chart of the way it happens, right? So here, those juxtaglomerular cells make renin, renin to the liver, liver makes angiotensin 1. Angiotensin 1 goes to the lungs take angiotensin converting enzyme, angiotensin 1 converts to angiotensin 2. That goes and tells the adrenal glands, hey, send out some aldosterone, which goes into the kidneys and says, hey, keep fluid, keep it, hang on to it, right? So that blood pressure goes up. Okay, pretty simple, I think. What else? Well, we know the kidneys make erythropoietin, right? That's that hormone that we need to go to our red bone marrow in order for our red bone marrow to make red blood cells. And the process is triggered by hypoxia, low oxygen levels, right? And then vitamin D. Vitamin D we get from our diet, but we get it from sunlight too, right? You need 15 minutes of sunlight a day to get some vitamin D. But the D we get from diet and sunlight's inactive and it's not really what we need. It's got to be converted in the liver and the kidneys. So if the body can't synthesize vitamin D, your bones are going to start breaking down, right? People that have end stage renal disease, they have to be given an active form of vitamin D as a supplement. Okay. So you getting all that? Kidneys are important. Without them, you can't live. Okay. This is the blood flow through the kidneys. So your abdominal aorta, remember, biggest artery, right? Coming from the left ventricle. Blood flows through the abdominal aorta and goes into the renal arteries, goes into even smaller arteries, and then itty bitty, teeny tiny afferent arterioles that go to the glomeruli, that go to the other arterioles heading out, peritubular capillaries, convoluted tubules. You don't need to know this like you need to know the blood flow through the heart. Just understand that every drop of blood in your body is going through the kidneys to get filtered. Okay. Every single drop right through the kidneys to get filtered, through the liver too, but we'll talk about that another time. We talked about the ureters, those two skinny tubes that go from the kidney, the renal pelvis of each kidney, down to the bladder. They carry urine, and the way they carry it is peristalsis, kind of like your intestines. That's squeezing and letting go, kind of pushes the urine down into the bladder for storage. And the bladder, like I said, is basically just a storage facility. It's this hollow sac. It's sterile. Inside the bladder is a sterile environment. The capacity varies anywhere from 200 milliliters to 1,000 milliliters. So let's talk about the things that you need to know. You should know that a bladder holds up to about 1,000 milliliters of urine. You should know that the term urinary retention means the inability to completely empty your bladder, inability to completely void. And as I told you earlier, you've got those two sphincters, right? One is involuntary, that's the internal one. The external one is voluntary. That's the one where you say, okay, I'm in the bathroom, I'm going to pee. And it releases and lets the urine out of the bladder. Okay. And this one just stays closed to keep the urine in the bladder so that you don't pee yourself. And that word is incontinence. Somebody that cannot hold their urine, that word is incontinence. I'm actually going to put that here. Continent. It's the inability to hold urine. or, peeing yourself. And I'm going to highlight that because you should know that. Okay. All right. And then the urethra, we talked about this already. For men, different sources say different things. Here they're saying 8 inches, 7.9 inches, close enough, right? The urethra passes from the bladder through the prostate gland. That is very important to remember when we get to med surg and talk about benign prostatic hypertrophy or hyperplasia. Okay, it's going to make sense, I promise. So the urethra goes from the bladder through the prostate gland and then through the penis and then right out. And for women, much shorter, right? It's only about an inch and 1.2 to 1.5 inches. And it is just straight from the bladder to the outside world. Okay. So is the following statement true or false? Men have a greater risk of developing a UTI, urinary tract infection, than women. Ready? If you guessed false, you were right. Okay. Women are the ones that typically get UTIs. Why? A couple reasons. Number one, the urethra is much shorter. The urethra is closer to the anus, right? And we already have bacteria that's in our stool, fecal material. And if somebody's older and they have arthritis and maybe they don't wipe front to back, or maybe there's, somebody's incontinent and their stool sitting close to the urethra, those bacteria are going to climb right up there, and infection is what happens next. Okay. Every day you pee somewhere between 750 mils to about 2,000 mils, depending on your lifestyle and how much you drink, right? This is a sample of just a urine analysis because you should at least become familiar with this. You won't be tested on it, but I want you to familiarize yourself with it, okay? When we look at a urine analysis, we're looking at things like how much urine did we get? Here we got 20 mils, and the patient is Mr. Dummy, which isn't very nice. The color should be amber to yellow, okay? And the transparency should be clear. There should be no sediment, no floaters, nothing like that, right? It should be clear when we look at it. The specific gravity talks about how concentrated urine is, okay? Is it thick? Is it thin? And a normal specific gravity is 1.005 to 1.03. So the reference range here, that is the norms, what it should be. The values are what the actual Mr. Dummy urine analysis results were. Okay. And it's looking at things like what's the pH? pH of urine should be 5 to 7. It's kind of on the acidic side. There shouldn't be any leukocytes, white blood cells. There shouldn't be any blood. There shouldn't be any protein in your urine. There shouldn't be any sugar, glucose in your urine. There certainly shouldn't be ketones or bilirubin or nitrites in your urine. Okay. Urine is just waste and water, right? So when we look at these things, we understand, for example, if someone has high levels of protein in their urine, they probably have some significant kidney damage. If they have glucose or ketones in their urine, what do you think? Diabetes, right? If they have bilirubin in their urine, think about bilirubin in the liver, right? So a urine analysis can give us a whole lot of information. And down here, we're looking at things like red blood cells, pus cells, epithelial cells, casts, which are kind of immature cells, crystals, crystalluria, the crystal sediment in the urine, bacteria in the urine. None of that should be present in a normal urine analysis. Okay? All right. And you're not going to be tested on that, but it's good for you to be familiar with it. Here again, this is just kind of reiterating how urine is formed. Those nephrons are really the ones. They're the ones that are the glomerular filtration units. They filter the blood, make the urine, right? And the urine goes through the ureters and goes into the urinary bladder, and then you pee it out. Okay? Glomerular filtration rates depend on a lot of things. They depend on the patient's age. Even the patient's ethnicity can have an impact on that GFR. Again, it'll make sense when we get to med surg, but I'm laying the foundation, like I always say, right? We already talked about reabsorption And so whether do the kidneys hang on to fluid or do the kidneys get rid of excess fluid, right? Very important. Remember ADH? Sure you do. Antidiuretic hormone? Well, when antidiuretic hormone gets secreted, released, then remember, diuretics make you pee, antidiuretics make you not pee. So they make the kidneys reabsorb fluid. Okay. When they do that, your urine's going to be a little more concentrated. Okay. And the secretion of the ADH depends on how much water's in our blood. Okay. So if we have a lower concentration of water in there, then that means our blood is going to be more concentrated and vice versa. So everything in the body is reliant on something else to make it to either make it happen or not happen. And all of it is all working together. And tell me it's not amazing to keep everything in the body just perfectly balanced. Homeostasis. That is the goal for every system in the body. Okay. Um, the formation of urine, and this is important, is influenced by a lot of things. It's influenced by, are your kidneys working right? Okay, that's important. Are they healthy? And is there sufficient blood flow going through your kidneys, right? Do you have any hormonal balances or imbalances that could be affecting it? Do you have any significant changes in your fluid or electrolyte status? Okay. And that's very important because we know electrolytes such as potassium, high or low, can really do a number on you. Salt, sodium, salt intake. Look at that. Whew. I can't say this enough. Salt is the devil. No one should be taking in more than a maximum of 2,000 milligrams of sodium in a day. Ideally, 1,500 milligrams is better. Okay, because you don't need salt. We just have developed a taste for salt. Okay, salt is not good for you. It makes you retain fluid. And then other things like our general condition, our state, how, are we healthy? Are we sick? Do we get any exercise? And then even medications. Certain medications can be what we call nephrotoxic. In other words, they can hurt the kidneys. So that influences how much urine is being produced by the kidneys, right? The quantities influence, like I said, fluids, salt. How much did you sweat? Are you bleeding? What's your blood pressure? Are you vomiting? What's the temperature outside? Are you doing drugs? Do you have a fever? Are you sick? All right. So all of these things contribute to how much urine is made and what it looks like. Okay. So characteristics, it should be clear, yellow, little bit of an odor, but it could be odorless. It should never be clear. It should not be colorless, right? Urine should not be colorless. That means you're drinking too much water. Urine can be amber, but it should not be dark yellow. I'm going to actually get rid of this. Okay. Dark yellow means you could be a little dehydrated. Certain foods and drugs can change the color of the urine. There's a drug called rifampin that's used to treat tuberculosis, and it will make your urine kind of a reddish, orangish, brownish color, right? Which is a little scary. Um, when urine sits out, it will become turbid. In other words, it looks cloudier and it will smell just like ammonia, right? Ever go into a place, I won't say what kind of facility, but maybe you get that ammonia smell. You know what I mean? That's the smell of urine. It's a little pH, the acidic, right? So it's somewhere between a 5 and a 7 pH, urine is. And the specific gravity is right around here. Here it says 1.010 to 1.025. It could be up to 1.03, actually. The higher this number, the more concentrated or thick your urine is. The lower this number, that could mean that your urine's a little too dilute. That could mean that you're drinking too much water, which is possible, or that something is wrong. You have some kind of a sickness, a physical disorder. Okay. Urine's mostly water, but it's nitrogenous waste and minerals and toxins and metabolites from drugs and hormones and all kinds of stuff, male sperm cells, pigments. But like I said, there should never be, and I want you to know this, never, never should there be, never, ever, ever should there be, never should there be blood, glucose, pus, large amounts of bacteria, casts, ketones, bile, or albumin. Okay. And albumin is protein. I'm just going to put that here. Okay. Oops. Protein. Never, 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 and never. Okay. Micturition, I mentioned that earlier. That's just another word for urination, voiding. Okay. Incontinence means that it's involuntary micturition, right? Urinary retention is not the inability to void, it's the inability to void completely, to empty the bladder. Okay. And sometimes when people have urinary retention or incontinence, there are lots of different reasons why those things can happen. Okay. I can't wait for the aging process. And there it is. Effects of aging on the urinary system. So again, just like everything else, things can slow down, and so can the urinary system. And the number and size of the nephrons can decrease. The blood flow can decrease. Lots of medications that older folks take, like diuretics, are potassium wasters, which means that they make the kidneys excrete potassium, which can be problematic. The lining of the bladder can start to get fibroids, come fibrotic. Um, Decreased ability to control bladder contractions, which they're called bladder spasms, can happen. Reduced sensation or the urge to urinate can also happen. With men, benign prostatic hypertrophy is very, very, very common. So we will talk about that when we get into med surge. But that's probably the most common thing that happens to men. Of course, anyone can develop cancer, sadly. With women, especially if you've had children and you don't do your Kegel exercises, the pelvic floor muscles can weaken or atrophy, and you can get what's called a prolapse, which is where your bladder kind of tries to fall out of your vagina. Not fun. Um, again, these things can happen with aging. They don't necessarily have to happen, but they certainly can happen. All right, we're going to wrap this up with a question. Is the following statement true or false? A client with chronic renal failure could show signs of anemia. Come on, you guys know the answer to this. You said true. Absolutely. Because if the kidneys aren't working, they can't make erythropoietin. And without erythropoietin, the red bone marrow can't make red blood cells. See? You know more than you think you know. All right. So that is the anatomy and physiology of the urinary system. I hope you enjoyed it. And that's it for today. See you later, alligators. Hope you enjoyed it. Bye.